So from the lymphatic system, what do you need to know? I would know that the cardiovascular, the cardiovascular system is bidirectional and has a pump. Lymphatic system is unidirectional, and the major fluid here is lymph. I would know these four essential components of the lymphatic system. So lymph is a colorless fluid. It's picked up by lymphatic capillaries, and it drains into the subclavian vein through trunks and ducts. And I would know that lymphatic tissues just make up lymphatic organs. Know this slide. So what percentage of fluid recovery is from the lymphatic system? 20%. I would know that number. The other major thing is that lymphatic system is, we know, involved in lipid absorption. So 95% of nutrients of lipid absorption happens through these structures called lacteals. Last major function, immunity. Other things here, I will not ask you about this. So, but I would know that, again, this is unidirectional, and that I would know that trunks flow into ducts. Trunks flow into ducts. Okay. I would know a little bit about lymphatic capillaries. And so, know that lymphatic capillaries have valves to prevent backflow, whereas regular capillaries don't. I would know what chyle lives in. Chyle, again, is lymphatic-rich fluid that's collected from the interstitium, and it's specifically from the GI tract. So it's a little bit different from other lymphatic fluid because it looks milky and it's collected from the GI tract. Chyle lives in what? Chyli. So chyli, the cisterna of chyli. So the cisterna of chyli is this kind of large sac that's here that collects lymphatic fluid from the GI tract. Chyle lives in chyli. I would know this, that the right lymphatic trunk is really only collecting from this small quadrant. The left lymphatic trunk is collecting from everywhere else. So, and where do those trunks end up? Well, either the right or left subclavian. I would know that you have about 600 to 700 lymph nodes, and then I would know that lymphatic fluid gets back into the systemic circulation through these three ways. It's got valves to prevent backflow. Every time you move your muscles, those muscles pump or milk the veins and the lymphatic vessels. And when you breathe, you're also moving lymphatic fluid. Okay. For this, you'll get a question about the difference between encapsulated and non-encapsulated lymphatic organs. What is the one non-encapsulated lymphatic organ? The tonsils. All the other ones, so bone marrow, thymus, spleen, those are all encapsulated. And I would know that that's a structural classification, not a functional one. Know that MALT exists in the GI tract, and it makes up about 70% of your immune system. And then I would know just the general difference between primary and secondary organs. Primary lymphatic organs make immune cells. Secondary lymphatic organs carry out immune functions. Make cells, carry out functions. That's happening in the lymph nodes. And I would know about this phenomena in the thymus, called thymic involution. The thymus shrinks as you get after you express sex hormones, and so the outside is the cortex, the inside is the medulla. The outside shrinks, that's full of uneducated cells. Inside you have educated immune cells. So know that in the thymus, the uneducated die and the educated live. That's dark. Okay. And then all of that is good. For the spleen, know that you can live without a spleen, but if you ruptured your spleen, you die. There's basically two types of pulp in it. It's just red and white. Red is just red blood cells being recycled. White is immune cells. know that you have 3 types of tonsils. And know that it's better to breathe through your nose and your mouth because that air has to pass through these different tonsils. So it's getting filtered. Okay, that's it for lymphatic system. Know these definitions. Where you're going to see this is the matching section of the exam. So we know what the terms here. Of course, know the difference. Know which one of these are accessory organs. Right? Know these accessory organs. In general, I would just know these functions, but I think we already know this. I would know that most of the absorption that occurs in the GI tract is happening in the small intestines, in the duodenum. I would know these layers well. So the same questions that you got in the quiz, you'll see again. And then for this one, what's important is really knowing this disposition of tissues. These epithelial tissues change in the mucosal layer of the alimentary canal. So at the mouth and anus, what you have is stratified squamous. In the esophagus, what you have is kind of simple squamous. By the time you get down to the intestines, what you're going to have are columnar cells. And then the connective tissues, muscular tissues, are pretty much the same everywhere else, except for the stomach. It's got that extra layer, right? So it's got the oblique muscular layer. Okay. Yes, know this. Know this. Know that the beginning of the esophagus, the first third of it, is skeletal muscle, and the anus is also skeletal muscle. And then we already talked about malt. Know that that lamina propria is mostly areolar tissue, and that muscular mucosa that's in that mucosal layer is involved in maintaining tone of the GI tract. Obviously know these 2 muscles and where they are. Peristalsis requires which 2 muscles? Circular and longitudinal. Segmentation requires which one of these? Just circular. And then I would know these peritoneal folds and what they connect. And so, if you're talking about the stomach to the liver, that's the greater omentum. I'm sorry, greater omentum is a fatty apron. I'm talking about connecting the stomach to the liver, lesser omentum. Falciform is the liver. If you're talking about connecting the small intestines, mesenteries, large intestines, that includes ascending and descending colon, sigmoid colon. That's the mesocolon. Yes. I would know what the round ligament does. And so it's a vestigial remnant of the umbilical cord. So I would know that. What will I ask you about? I have no idea if I'm going to ask you anything about this. Probably not.
What?
You have teeth. Teeth exist. This is more important. Know that teeth don't contain collagen, that they're cemented in this alveolar socket with cementin. The periodontal ligament absorbs shock as well. Know these functions of saliva. So lubrication, immunity, and obviously saliva has amylase in it that breaks down carbs. Just know where these are, LES and UES. Know what rugae are. Know that rugae are not increasing the surface area of the stomach. So they're not involved in absorption, but they just let the stomach stretch and expand. Okay. I would pay a little bit of attention to this because you'll get a few questions about this. Know that parietal cells secrete this hydrochloric acid and intrinsic factor. This is an important thing to know. I would know that the stomach is coated with mucus by these mucus neck cells that protect the stomach. And then you also have G cells which secrete gastrin. That initiates the process of acidifying the stomach. And then you've got these other little cells called chief cells. They make pepsin, which breaks down proteins. So I'm gonna make a little note. Pay particular attention to this slide. Good. I would know that this is the pancreatic duct. This is the accessory duct. And make sure you know that the common bile duct intersects with this pancreatic duct, and everything leaves out of here or enters into the ampulla vader and then goes out that major duodenal papilla here into the duodenum of the small intestine. Know the difference between exocrine and endocrine functions of the pancreas. Exocrine functions are done by the pancreatic acini. That's 95% of those cells. The islet cells are involved in regulating hormones like insulin, glucagon, somatostatin from the islet cells. So make sure you know that. And then these are just enzymes that are secreted by the pancreas. But know that these enzymes are just really part of that exocrine function. That's the important thing to know. And then you'll get one multiple choice question about these cells. Alpha is glucagon, beta, insulin, delta is somatostatin. F cells secrete this pancreatic polypeptide PPP, but I won't ask you questions about pancreatic polypeptide here. And then for the liver, I would know what the portal triad is. And what that is basically these little things here. And so what you have in the portal triad is a bile duct that's moving bile away from the central vein. And then you have the portal vein and the hepatic artery. Portal vein is feeding this central vein, and that hepatic artery is supplying all of these hepatocytes with oxygen. So know what the portal triad is. It's these three structures in the liver level. Know about the non-digestive and digestive functions of the liver. All of the non-digestive deal with blood. The digestive is like making bile, processing lipids, detoxifying, storing sugar, that kind of stuff. The non-digestive all deals with blood. Thickening blood is albumin, thinning blood is heparin. And so we know that. Okay. Hepatocytes make up most of the liver. And then you also have these little Kupffer cells. I may not ask you a direct question about these, but they're immune cells. You might see them in a list of multiple choice questions. Okay. Gallbladder here. I would know the functions of the liver. So to make bile, gallbladder stores bile. And know that the cystic duct is a bidirectional duct that connects to the common bile duct. There are two, and then, again, we already talked about this. So where the common bile duct and pancreatic duct meet, that's this ampulla of vader, or the hepatopancreatic ampulla, or ampulla of vader. And then this is the duodenal papilla here. Everything exits here. Okay. And know the small intestine has these three parts: duodenum, jejunum, and the ileum. Most absorption happens in this 1 foot of the duodenum duct. Know what segmentation is. And then I would know kind of from macro to micro, small intestines can absorb nutrients because of its anatomy structurally. So what you have are these folds called the plicae circularis. You can see those on a macro level, just with the naked eye. If you zoom in and use a microscope, you'll see these villi, which are on the cells. And so those are those little villi that you'll have that have those columnar cells. And then each of those columnar cells are going to have microvilli. This is what's really increasing the surface area of the small intestines. It increases the area of the small intestines to that of a tennis court, essentially, in terms of its absorptive abilities. Know that lacteals absorb lipids. And then for this, absorptive cells absorb water, goblet cells secrete mucus. Pannate cells are also immune cells, but not in the liver, they're in the small intestines. And then you'll get one question about these little hormones here, okay? These enteroendocrine cells. And so it's kind of simple if you think about, so CCK makes a gallbladder release bile. Secretin makes a pancreas release sodium bicarb. So both of these are involved in releasing things, either from the gallbladder or from the pancreas. This GIP is inhibitory, so it's slowing down stomach acid. The reason you release these is to kind of get rid of stuff from the GI tract to make room for more things to come in. I'm going to ask you to identify Brunner's glands on that intestinal villi model. So these guys act like little tiny pancreases. They're scattered throughout the small intestines. So we're talking duodenum, ileum, jejunum. They inactivate stomach acid. And then know this tenei coli, that's the smooth muscle that make the haustra that we see in the large intestines. Last thing to really know about the large intestines is that the ascending and descending are retroperitoneal. And all that means is that they're sitting behind the greater omentum. The transverse colon is sitting on top, but it's not behind. So this section is not retroperitoneal. The appendix does not have a function. You can control one of these sphincters. Is it the internal or the external? External. The end. Okay. So that's GI. That's a lot of stuff that's in there. All right. I would know these functions. Kidneys make. Okay. Sorry. So I would know these functions. And so kidneys regulate fluid volume and fluid composition, and that means these ions. Kidneys help to make red blood cells by producing EPO, and obviously the kidneys eliminate waste. I won't ask you about that. Note some of the wastes that are produced by the kidneys. It includes this list here. And then I would know just kind of location of stuff. I would know that one kidney is higher than the other. Which one is higher than the other? Is it the left or the right? Left is higher than the right. Right is lower because the liver is kind of pushing it down. I will not ask you anything from here. I'll put them there. And then I would, okay, let's see. What will I ask you? I would know that the renal columns anchor the cortex to the medulla. Okay. That the renal medulla is made up of pyramids, and there's 6 to 12 pyramids. And the medulla concentrates here. When urine is produced in the medulla, it goes out this minor calyx to the major calyx and the renal pelvis, and then down the ureter. And then you might get one or two multiple choice questions about just this path of blood, but mostly this is going to be on the models. And so make sure that you can identify renal, segmental, interlobar, or QA cortical radius. Same stuff. And then make sure, I would note this slide. You'll get a question about this. Juxtaglomerular make urine, they make up 20%. Corticals do not make urine, they make up 80%, and the blood is just passing through. Cortical, short loops of Henle, juxtamedullary, long loops of Henle. And make sure you know these capillary beds. You'll see this twice. So you'll see it on the practical, and you'll see it on the exam. So the vasa recta are the ones that are associated with the ones that are producing urine. So the juxtamedullary, they're lower down. That's this capillary bed here. Cortical nephrons are associated with the paratubular capillaries. The way that I remember paratubular is I think perimeter is around the edge. So paratubular are associated with the cortex. Paratubular. Then I'll ask you this more in terms of identification. And so this is for models. I would know that the bladder has a special muscle called the detrusor muscle. The detrusor muscle. And then there's also this area called the trigone that's involved in the micturition reflex. Micturition means you need to pee, right? So that's where this trigone is what stimulates that reflex. Again, two sphincters here, internal, external. We can only control this external one. I just settle that. I would know that the urethra of men is longer than the urethra of women because it has to pass through the prostate gland. Know what podocytes are, and that these podocytes make up the visceral layer of the glomerulus. And then you'll get one question about these cells. And so this is called the juxtaglomerular apparatus. Again, these cells here, the commonly tubule, it's a macula densa. These guys taste salt. Okay. Macula densa tastes salt. Juxtaglomerular cells clamp down the afferent arteriole. And the mesangial cells, they can constrict both of these. So they can shut down blood flow totally to the podocytes here. That's right. Respiration and ventilation. And know the two types. So and it's simple, right? Ventilation is just inhaling and exhaling. Respiration is gas exchange. There's external and internal, and that's simple too. So external is happening in the alveoli, the lungs. Internal is happening at the level of tissues. I would know that you have peripheral and central chemoreceptors. And I also know that bicarbonate is buffering most of the acidity in your blood in terms of buffering the carbon dioxide that's being produced. Key concept here is that in the conducting zone, there's no gas exchange. There's no gas exchange here. Gas exchange begins at the respiratory bronchioles. Is there gas exchange at the terminal bronchioles? No. There's gas exchange though at the respiratory bronchioles. So this is where gas begins to exchange. I'm not going to ask you about the nose. I would know the purpose of the conchas are to humidify the air. Know that the pharynx has 3 parts to it. And then know what the function of this epiglottis is. It's to cover up the trachea when you're eating or drinking. Okay. You'll get a couple of questions about this. And so you'll get at least one multiple choice question. Know that there's a difference between paired cartilage and unpaired cartilage. Paired cartilage are these here. Unpaired are these, epiglottis, thyroid, and cricoid cartilage. These other ones are paired. And then there's a lot of stuff here about these muscles, but the only 2 I'll ask you about are these 2. Okay. I would know that the cricothyroid is involved in increasing pitch. Thyroarachnoid, decreasing pitch. Increasing and decreasing. And with the C is increasing, thyroarachnoid, decreasing pitch. Know what the carina is. That's where the cough reflex is stimulated. And know that the trachealis muscle is only found on the posterior side of the trachea. You have cartilage on the anterior side. Trachealis muscle controls the diameter of the trachea. Okay. I will not ask you about histology, but you should know that the mucosal layer of the trachea is that pseudo-stratified columnar epithelium. know what the mucociliary escalator is. Elevator. Something like that. I would just know right side is 3 lobes, left side is 2. What else will I ask? I would know this. So know about alveolar cells, type 1, type 2, and these alveolar macrophages. And then I won't ask you a direct question about this. What I will ask you about are these muscles. And so just know that inhaling is an active process where you use the diaphragm. But exhaling is a passive process. That's just the recoiling of the diaphragm. In secondary inhalation and exhalation, you recruit muscles. And so to inhale, you're trying to increase the diameter of the thoracic cage. And so all these muscles that are up here are involved, so in your neck. So that's the sternocleidomastoid, pec minor, and scalenes. And then when you breathe out, forced exhalation, you're breathing from your gut, you're exhaling from your gut. So that's going to just be all these abdominal muscles. One thing that's a little tricky is that the external intercostals are pulling the ribs open. Internal intercostals are pushing the ribs closed. So just some fine points. I won't ask you about that. Okay, we're done.